Hello everyone, my name is Michael Albrecht. I'm an internal medicine physician, and today I'm going to be talking about what is internal medicine. In this talk, we're going to understand the steps to become a physician in the United States, understand what the requirements are to become an internal medicine physician, describe the difference between an internal medicine physician and a family medicine physician, understand what medical specialties are branches of internal medicine, and we'll detail what internal medicine physicians can and cannot do well. To become a physician, you have to go through several steps of training. First, you have to obtain a bachelor's degree. This can be from any college or university and can be of any type. For example, you can have a bachelor's degree in music and go to medical school. However, you do have to complete certain requirements for coursework prior to trying to get into medical school. For example, you have to take certain biology classes, anatomy and physiology. I remember having to take organic chemistry 1 and 2, which was very difficult, and then 1 semester of calculus, and several other prerequisite courses. After you get into medical school, you have to go through 4 years of medical school training, typically. This is either an MD or medical doctor or a DO program. The first 2 years of medical school are usually intense classroom-based work. You usually are studying all day, every day, for 2 years. Your third and fourth year of medical school are typically clinical years where you do rotations in different specialties in the clinics and hospitals. And you have to pass numerous, usually multiple choice tests along the way. Following medical school, you are now a doctor, but you don't have very much experience, and so you're not a very good doctor when you first graduate medical school. And so you have to complete a residency training program in order to become better as a doctor. And so surgeons, for example, complete a 5-year surgical residency. Orthopedic surgeons complete a different residency. OBGYNs complete a different residency. Internal medicine physicians complete a different residency. That's 3 years. Pediatrics is a different residency. So you can see your specialization occurs after you complete medical school and you go through a residency training program. The residency training program is typically the most intense period of training in a physician's life. For example, in residency, I remember my second and third years especially, there were some rotations where I would do 28-hour shifts in the intensive care unit every 3 to 4 days. So it was a very intense period of training in life, and most physicians are relieved once residency is over. And then after residency training, you typically need to pass a board exam. For example, a board exam in internal medicine would let you become board certified in internal medicine, which shows that you have the understanding, knowledge to be a good internal medicine physician. You also must obtain a medical license to practice in 1 or more states in order to practice medicine. And then it's optional to complete additional training following your residency program. And the additional training following a residency is called a fellowship. This slide tells you what it takes to become an internal medicine physician, which is similar to the previous slide, except we're just focusing on internal medicine here. So an internal medicine physician completes a bachelor's degree in any field. Again, it can be music or biology or whatever. And then you get a medical degree, in my case, an MD degree, by graduating from medical school. Following that, you complete a 3-year internal medicine residency training program, and then you would try to take the internal medicine board exam to become board certified in internal medicine. Just like any doctor, you then have to obtain a medical license to practice medicine in 1 or more states in the United States. People I talk to are typically confused on the difference between internal medicine and family medicine. We do have some similarities to family medicine. We are both general physicians. We're not subspecialized per se. Family medicine physicians, though, complete a family medicine residency, whereas internal medicine physicians complete an internal medicine residency. Family medicine residencies are typically broader in scope than internal medicine. In addition to treating adults, family medicine physicians are also trained to treat children. So they're trained in pediatrics and they're also trained in obstetrics. So you might imagine that internal medicine, which only focuses on adults, is very, very good at treating adult patients. Whereas family medicine is good at treating adult patients, but they don't get quite as intensive a training in adult medicine. They're also focused on treating children and obstetrics or delivering babies and prenatal care. So internal medicine physicians typically teach internal medicine residency programs, but we're also, as internal medicine physicians, trained by many different medical subspecialists. For example, we'll have several cardiology rotations, infectious disease, rheumatology, nephrology, all sorts of different medical subspecialties. Whereas family medicine physicians will have some of that, but again, are more general in scope and broader in scope, and typically trained by family medicine physicians for the most part. We're also different than family medicine because internal medicine physicians often go on to subspecialize in one of multiple different fields that start out with the requirement of an internal medicine residency, whereas family medicine is much more limited in scope in what you can do as a subspecialist after family medicine. So we'll talk about that on the next slide in more detail. So after completing an internal medicine residency, these are the subspecialty fellowships you can complete to become more subspecialized. Family medicine physicians don't have the option of subspecializing in these fields, whereas internal medicine physicians who've completed a residency then go on to complete, or they can go on to complete one of these fellowships: so cardiology, endocrinology, gastroenterology, or hepatology, hematology, oncology, infectious disease, nephrology, pulmonology and critical care, rheumatology, and allergy and immunology. Family physicians can also subspecialize in certain fields, but none of these on this slide. So family medicine physicians could go on to complete fellowships in things like geriatrics or addiction medicine or sports medicine. So what are internal medicine physicians good at? So internal medicine physicians are really good at diagnosing, treating, and managing medically complex adults with numerous health problems. So of course, we're also good at treating basic problems like hypertension and high cholesterol and things like that. But where we really shine especially is when our patients have, say, 20 or more medical problems and they're on 20 or more medications, and you're trying to understand how all of these things interact with each other. Internal medicine physicians are trained to deal with that medical complexity, probably in ways that other medical specialties are not. And for that reason, actually, most of our training as internal medicine physicians is in the hospital. And we are trained pretty much in our residency to become hospitalists, which are doctors that only treat patients in the hospital. You will see some family medicine physicians being hospitalists, but most hospitalists in the United States are internal medicine physicians. But we're also trained to treat non-hospitalized patients. So you'll see internal medicine physicians being primary care physicians for adults. You can also see them treating patients in nursing homes or rehab facilities. Internal medicine physicians are thinkers and problem solvers. So we're good at solving complex medical problems and thinking about them and thinking what the possibilities are for diagnoses and making sure we dot our I's and cross our T's when it comes to taking care of patients. And for that reason, internal medicine physicians are often called the doctor's doctor, which are clinicians others turn to when the diagnosis or management is unclear. But internal medicine physicians definitely don't know everything, and we're not good at certain things. So we're definitely not good at obstetrics, which is delivering babies or taking care of pregnant patients through their pregnancy. We are not qualified to take care of children. We're not trained in pediatrics other than 1 month in medical school. We're not surgeons, so we don't go to the operating room and treat patients there. We'll do minor procedures at the bedside, but not surgery. And we're not good at treating all conditions because some conditions require very subspecialized knowledge. For example, oncologists know how to treat cancer with chemotherapy and radiation. Internal medicine physicians don't know how to do that. I just want to put a plug in about my new internal medicine clinic called BrightMed Clinic. It's a clinic in Lansing, Kansas that's opening to see patients July 7th of 2025. It's an internal medicine primary care clinic. I, as the founder, also have subspecializations and board certifications in obesity medicine, and I'm about to complete my board exam in clinical informatics, so hopefully soon I will also have that board certification. I'm also experienced as a prior hospice and nursing home medical director. Of course, I was a prior primary care physician and hospitalist in the past. I also have been a wound care and hyperbaric oxygen supervising physician previously. But I'm also continuously upgrading my skills. For example, right now I'm trying to learn to diagnose problems using ultrasound at the bedside. And just to summarize, internal medicine is a general medical specialty that focuses on treating adult patients. We're good at managing medically complex patients. We do share similarities with family medicine, but we're specialized in treating non-pregnant adults, whereas family medicine is more broad in scope and also treats patients who are pregnant as well as children. Thank you very much.